I'm Dr. Daniel Kantor, Neurology in Real Time. I'm here at the Consortium of MS Centers Annual Meeting in Seattle, and I'm joined by Professor Frauke Zipp, who is the Director of the Department of Neurology at the University Hospital in Mainz. Thank you so much for joining us. You gave the Whitaker Memorial Lecture, and you gave on a very interesting topic. It was on the crosstalk between the immune system and the nervous system. But many people back home thought that MS is just an autoimmune disease. Why is there this crosstalk?
So the crosstalk is, I have to say, a much more fundamental activity between the immune system and the nervous system, which is not only important, and this is what we know now, in disease, but also in normal function of the central nervous system, of the brain and the spinal cord.
So that means that our immune system is talking to our nervous system, and then we've heard from other lecturers that our gut is also talking to our nervous system, our immune system. So really our body is not these separate units that we all talk about.
Exactly, that is really the case, and we have to take into account all these different interactions between the organs, and specifically concerning the crosstalk of the immune and the nervous system. It's not only that the immune system induces inflammation in the CNS. One has to see that the immune system has also capability of, in the case what I presented, repairing in the CNS.
Now, you talked also about the idea of anxiety, and you talked about anxiety not necessarily being what we call a comorbidity. That means you have one disease or one diagnosis, MS, and you have another one, anxiety, and they sometimes go together. That's what a comorbidity is. But you talked about how there's actually maybe more interaction. Can you tell us a little bit more about that?
So we have evidence that anxiety may be part of the pathology, since we found in the remission phase, as response to the primary attack, inflammatory attack, we found an increase in anxiety, and we dissected the underlying mechanisms, namely an hyperactivity of the microcircuits, the neuronal microcircuits in the cortex.
Now, what does this mean for somebody who has MS and anxiety? Does that mean that their anxiety is definitely part of their MS and not something separate? How can somebody tell?
So this is what we, from all our results, assume currently. And we are currently in our patients' cohorts trying to find out how we can really distinguish whether it's a comorbidity and or whether it's part of the pathology, which is certainly not so easy. But I think the most important thing is to treat that. And we have now discovered an underlying mechanism where we work on therapeutic reduction of this hyperactivity. And once we are there, we may have a tool to better really treat anxiety. But this is a way to go still.
Does that mean that we're going to be able to find a medicine that helps potentially both the nervous system and the immune system? Instead of helping one or the other, we'll be able to kill two birds with one stone, as we say?
This is my hope. We have preliminary experiments where we think this is really the case. We will see. It's too early to really confirm that what you just suggested, but that's the idea behind.
Now, does this also mean that potentially anxiety could cause multiple sclerosis?
I don't think so. For in our observations, this is really a response to the initial acute inflammatory insult to the brain, and I don't think that anxiety is inducing really multiple sclerosis. I think there we are coming to your first sentence that MS is an autoimmune disease, and that we, with all autoimmune diseases, do not really know how they are starting off.
So this means, though, potentially that in somebody with MS, if their MS is getting worse, their anxiety might get worse at the same time.
Yeah, but this is also a little bit too far-fetched at that moment.
Okay.
But my hope is if we give this medication very early, which reduces this hyperactivity, then we can really ameliorate anxiety.
What are the chemicals involved with that hyperexcitability?
So this is again very interesting because it's a subsequence of the crosstalk of the immune and the nervous system, and we found tumor necrosis factor alpha in excitatory neurons in the cortex increased.
Okay.
And so it's again an immune cytokine having a completely different function than just being mediator of the pro-inflammatory context in MS.
This is also a great example of why we do have to wait for research to develop before we jump to conclusions.
Yeah.
Because we know that TNF alpha blockers can also be dangerous in people without MS and with MS, where it looks like it can uncover multiple sclerosis.
Yeah.
Professor, I want to thank you so much for joining us and for your research, and I want to thank all of you back home for joining us at Real Time Neurology.